You probably think a heart attack comes with drama-crushing chest pain, clutching your arm, collapsing to the floor. That's what television shows. That's what most people imagine. But after 60, the deadliest heart attacks don't happen during the day. They happen while you're sleeping. No warning, no time to call for help, no second chance. And here's what shocks my patients the most: those silent, overnight events are almost always triggered by ordinary habits. Things you do every evening without a second thought. The meal you eat, the pill you skip, the temperature in your bedroom. I'm Dr. Raymond Cole. I've spent over 20 years treating seniors with heart disease. Tonight, I'm going to reveal 5 common nighttime habits that quietly destroy your heart while you sleep and exactly how to fix each one. This isn't about fear. It's about giving you a simple, practical evening routine that could save your life. Stay with me. Let me explain something most doctors never mention. Your heart doesn't rest when you sleep, it changes how it works. In a healthy younger person, blood pressure naturally drops by 10 to 20% at night. Heart rate slows, arteries relax. It's a repair mode. But after 60, that system becomes unreliable. Your blood vessels stiffen, the signals that normally lower your nighttime blood pressure get weaker, and the margin for error shrinks dramatically. During the day, your body has backup systems. If something goes wrong, it compensates. At night, many of those backup systems are offline. Your body is running on a skeleton crew. That's why the hours between midnight and AM carry the highest risk of heart attack and stroke for anyone over 60. Not the afternoon rush, not the morning workout, the quiet hours when no one is watching. And what happens during those dangerous hours is largely determined by what you did before bed. Let me walk you through the 5 most common nighttime heart hazards I see in my practice, starting with the one that surprises almost everyone. The first dangerous habit is eating a heavy meal late at night. I ask every new patient the same question: what time did you eat dinner last night, and what was on your plate? Too often, the answer is 8, 9, even PM: pasta, rice, fried foods, a large portion of meat. I understand why: busy schedules, family dinners, lifelong habits. But from a cardiac perspective, this is quietly harming your heart. Here's what happens inside your body. When you eat a large meal, your digestive system demands a massive increase in blood flow. Your heart has to pump harder. Blood pressure rises. Within 2 to 4 hours after eating, your blood levels of triglycerides, a type of fat, spike dramatically. Now combine that with going to sleep. Your body expects the evening to be a wind down. Instead, your heart is working overtime to digest, while also trying to shift into nighttime recovery mode. Those two demands conflict. In a person over 60 with any arterial stiffness, that conflict has real consequences. Studies have shown that eating within 2 hours of bedtime is associated with higher nighttime blood pressure, more acid reflux, which can mimic heart attack symptoms, and an increased risk of cardiovascular events during sleep. The fix is straightforward. Finish your main meal by 6:30 or PM. If you need a late snack, keep it light: a small piece of fruit, a handful of nuts, or a few bites of yogurt, never a full dinner. The second dangerous habit is taking your blood pressure medication at the wrong time or forgetting it entirely. More than 60% of seniors over 60 take medication for high blood pressure, but most take it in the morning, and many never think about timing again. Here's the problem: in a significant number of older adults, blood pressure doesn't dip at night as it should. Instead, it stays elevated or actually surges during the early morning hours between AM and AM. This is called nocturnal hypertension, and it's dangerous in ways that daytime high blood pressure is not. Why? Because while you sleep, your artery walls aren't braced for impact. A pressure surge at AM hits a vulnerable plaque differently than one at PM. It's more likely to rupture that plaque, trigger a clot, and cause a heart attack. If you take your blood pressure medication only in the morning, its effect may wear off by the time you need it most, the early morning hours. If you skip it entirely, you're leaving yourself completely unprotected during the most vulnerable window. What should you do? Have a simple conversation with your doctor. Ask specifically: would I benefit from taking my blood pressure medication at night instead of in the morning? Major trials, including the chronotherapy trial, have shown that evening dosing significantly reduces heart attack and stroke risk during sleep. That one conversation, 2 minutes with your doctor, could be the most important medical discussion you have this year. Don't assume timing doesn't matter. In cardiology, timing can be everything. The third dangerous habit is limiting fluids in the evening to avoid nighttime bathroom trips. This one breaks my heart because the logic seems so sensible. You want to sleep through the night. You want to avoid falls if you get up in the dark. So you stop drinking water after dinner, sometimes after PM. I understand. Completely. But from a cardiovascular standpoint, going to bed even mildly dehydrated is a meaningful risk factor and almost nobody talks about it. Here's what happens. When you're dehydrated, your blood becomes thicker, more viscous. It doesn't flow as freely through your vessels. For a young, healthy heart, that's a manageable inconvenience. For a person over 60 with arterial stiffness and plaque buildup, it's a very different story. Thick blood moves slowly through already narrowed arteries. It's more prone to forming clots. Now add the fact that during sleep, your heart rate naturally slows. Blood moves more slowly through your system anyway. Combine slow circulation, thicker blood, a body lying still for 7 or 8 hours, and arteries that may already be narrowed. That combination is one of the main reasons heart attacks and strokes cluster in the early morning hours. The fix is remarkably simple. Drink a full glass of water before bed, about 8 ounces. Not a huge amount, just enough to ensure your blood doesn't thicken unnecessarily while you sleep. Keep another glass on your nightstand for when you wake up thirsty at a.m. That moment of mild thirst is your body asking for something your heart also needs. You don't have to choose between sleep and cardiovascular protection. The fourth dangerous habit is ignoring your bedroom temperature. Most people have never once thought about room temperature in terms of heart health. They think about comfort, but there is a specific temperature range that your cardiovascular system prefers, and outside that range, your heart quietly works harder than it should. Let's start with a bedroom that's too warm, above 22°C72F. Your body works to dissipate heat throughout the night, blood vessels dilate, your heart rate stays elevated, sweating increases fluid loss, which brings us right back to the dehydration problem, and critically, your sleep quality drops. You spend less time in deep, restorative sleep, the stage where your heart gets its best overnight recovery. Now consider a bedroom that's genuinely cold, below 16°C61F. Cold causes vasoconstriction. Your blood vessels tighten to preserve core body heat. Blood pressure rises. Your heart has to push against more resistance. For someone with existing coronary artery disease or hypertension, that nighttime pressure increase is not trivial. The optimal range for sleep and cardiovascular protection is between 18°C and 22°C65F to 72F. That window keeps your body in what physiologists call thermoneutral territory, vessels relaxed, heart rate low and steady. Sleep deep. One simple setting on your thermostat, real protection, cost you nothing. The fifth and final dangerous habit is ignoring snoring, especially the kind where you stop breathing. I want you to think about someone you know who snores loudly, maybe yourself. Most people treat snoring as an annoyance, something to laugh about. I treat it as a cardiac warning sign until proven otherwise. Obstructive sleep apnea is one of the most underdiagnosed conditions in seniors over 60. It's estimated that over 30% of older adults have it, and the vast majority have never been diagnosed. Here's what actually happens during an apnea episode. You stop breathing for 10, 20, sometimes 40 seconds. It can happen 30 or more times per hour. Each time, the oxygen level in your blood drops sharply. Your brain registers a crisis and fires off a stress response, adrenaline, cortisol, a sudden spike in heart rate and blood pressure. Your heart essentially jolts awake while the rest of you stays asleep. Night after night, year after year, the damage is not subtle. Sleep apnea is directly associated with a 3 times higher risk of heart attack. It's strongly linked to atrial fibrillation, an irregular heart rhythm that dramatically increases stroke risk. It accelerates the thickening and stiffening of arterial walls, and because you're asleep for all of it, you often have no idea until something serious happens. The warning signs aren't always loud snoring. Watch for waking up with headaches, feeling exhausted even after a full night's sleep, needing to urinate frequently during the night, waking up with a dry mouth, or a feeling of choking. If any of those sound familiar, talk to your doctor about a sleep study. The treatment, usually a CPAP device, isn't glamorous, but the data on what it does for heart health is remarkable. Patients who use CPAP show measurable reductions in blood pressure, lower rates of atrial fibrillation, and significantly reduced cardiac risk. One device, one habit, enormous protection. Now that you know the 5 dangerous habits, let me give you a simple, practical blueprint that addresses every single one. I call it the heart-safe evening routine. It fits into a normal life without dramatic changes. Here's how it works. Between 6 and p.m., finish your main meal, lean protein, vegetables, a moderate portion of carbohydrates if you need them. Not a feast, not a fast, just a proper dinner at a reasonable hour. This gives your heart a full 3 to 4 hours to settle before sleep. At p.m., drink a glass of water. And if you take blood pressure medication, this is the time to have that conversation with your doctor about evening dosing. Don't change it on your own, but ask the question. Between 8 and p.m., start your wind down window, a gentle walk around the house, some light reading, a calm conversation. Step away from screens, especially bright phone screens, which suppress melatonin and keep your nervous system alert far longer than it should be before sleep. By p.m., prepare your bedroom. Adjust the thermostat to between 18 and 22 C 65 to 72 F. Open a window briefly if the room is stuffy. Place a full glass of water on your nightstand. These take 90 seconds. They matter. By p.m., you're in bed. And here's one final detail that costs you nothing. If you snore or have been told you stop breathing during sleep, try sleeping on your side rather than your back. Back sleeping worsens airway obstruction dramatically. A simple positional change can reduce apnea episodes significantly while you work toward a formal evaluation. Dinner by 7, water and pills after doctor's guidance by 7, calm evening until 9, room prepared by 9, bed by 10, on your side. The question isn't whether this routine works, the data is clear that it does. The question is whether you'll actually do it, and that's a question only you can answer. Let me be honest with you. I've sat with families in hospital waiting rooms at dawn, families who had no idea anything was wrong when they said goodnight just a few hours earlier. I've read reports on patients who were planning their grandchildren's birthdays the week before. In case after case, the contributing factors were not mysterious. They were a late dinner, a skipped medication, a bedroom that was too warm, a body quietly running out of water, an airway collapsing silently for years while everyone assumed the snoring was just snoring. These are not exotic risks. They are the background noise of millions of ordinary evenings, and that background noise, accumulated night after night, year after year, can become a cardiac event that nobody saw coming because nobody knew to look. You now know. The question is what you do with that knowledge. Tonight, not next week. Tonight. Before I say goodnight, this disclaimer: everything in this video is for educational purposes only. It is not a substitute for professional medical advice. Never change your medication timing or dose without talking to your own doctor. Your personal health situation is unique, and only your physician can make safe recommendations for you. I'm Dr. Raymond Cole. Your heart has been working for you every single minute of every single night for your entire life. It doesn't take a vacation. It doesn't complain, it just keeps beating. The least you can do is give it the conditions it needs to keep going. Share this video with someone you love, a spouse, a parent, a friend over 60 who has never once connected their nightly habits to their heart. That share might be the most important gift you give this year. Hit subscribe to Senior Health Hub for more honest, life-saving information. Next week, we're talking about the 3 morning signs that your heart is in trouble and what to do immediately. Sleep well. Take care of yourself, and I'll see you in the next video.